Covering your health tonight, the U.S. Surgeon General says the dangers children are exposed to on social media are severe.
News 15's medical editor Dr. John Lepre breaks down the potential mental health harm posed to children and teenagers.
Today, the Surgeon General issued an advisory on the use of social media and the mental health of young people. Dr. Murthy states, "We don't have enough evidence to say it's safe. And in fact, there's growing evidence that social media is associated with harm to young people." This statement goes on to say that children are being exposed to harmful content on social media and it compromises their sleep and relationships with family and friends. Social media usage is universal amongst teens. In fact, 1/3 of teens report using social media constantly. 1/3 of preteen girls feel addicted to social media platforms. 46% state social media made them feel worse, while only 14% made them feel better. Most alarming, 64% of adolescents report exposure to online harassment. Remember, the part of the adolescent brain that deals with reasoning and judgment isn't fully developed until their early 20s. And adolescents lack the ability to properly filter what they see online. It's a time of rapid physical, emotional, and cognitive development. Now, the Surgeon General has these recommendations backed by several organizations. Policymakers can strengthen safety standards and protect children's privacy. Technology companies can share data with independent researchers and prioritize adolescent safety and mental health. Parents and caregivers can establish technology-free zones and better foster in-person communication with their teen. Finally, children and adolescents can limit time on platforms, block unwanted content, avoid sharing personal information, and reach out to a friend subjected to harassment. Add in peer pressure, and that's a lot for a teenage brain to handle. We probably all know a few adults who fall into this trap as well. So stay safe online, and wishing you better mental health. Dr. John Lepre, News 15.